are definitely some spots up there if you want to try to squeeze in to grab these. It's all good. Right. Well, good morning, everybody. Good morning. I see some familiar faces and I see some new faces, and what an awesome turnout. And hopefully today is valuable for you. I'm going to try to give you as much information as I can, both personal experience and then experiences as a physical therapist. So if you have any questions or if you want me to repeat stuff, please don't hesitate. Not a lot of you guys took advantage of the coffee and the snacks. It's a pretty laid-back experience. So if you want to get up, you want to stand up, you don't have to sit, that's fine. I don't mind at all. In fact, it probably makes me feel more comfortable if people are kind of standing and walking around. So, don't hesitate to get up. I know I have this scheduled from 10 to 12. I would imagine the content's not going to go till 12, but I'm going to stay as long as it takes to answer any questions you guys have. So if you want to grab me at the end and ask me, please don't hesitate. And we're going to have some helpers here at the end too that would be able to answer any questions you have as well. So again, thanks for coming. What a beautiful day. We'll try to get out of here quick because it's so nice out, but low back pain. Obviously there's a lot of people that have it. I mean, look at the room. This is amazing. I would never have guessed that we would have had 65 people sign up for this. So let me tell you a little bit about why I wanted to do this, what the purpose is. I'm a physical therapist. I'm the founder of Superior Physical Therapy, and I also was a back pain patient. When I was 24, I had disc herniation, and I went through every imaginable treatment that's out there for lower back pain, including surgery, injections, medications, massage, chiropractic, physical therapy, acupuncture, you name it, I've done it. And when I look back at my experience, there was a lot of times when I didn't have information, and I kind of got stuck in what I call the healthcare system. So you end up in a system where you just don't know what's going on, and you're uneducated. And so that's really the purpose today, is to try to educate you and provide you resources, not trying to sell you anything. I'm not here to try to get you to do things, just to give you information. So that's the purpose. And I've got some, what I think, handy resources to give you. Right now in front of you have a worksheet, and you also fill out a registration form. Don't worry about the insurance information on there. That's an old form, and all I wanted to know was the type of insurance. And we'll talk about that at the end here, why. There's actually a really good reason why. So that's, does anybody, let's start with you guys. Does anybody have the desire to share their story, why they're here, what's going on in their life? I've got a great story to share with you, so I'm going to go into details about mine. But I'd love to hear if anybody wants to share.
I have 7 fusions in my back.
Okay.
Dealt with low back pain for the last 15 years, and they sent me to Grand Rapids because they couldn't do multi-level fusions here. I would just like to walk into my own age,
Sure.
and I need help doing that.
Sure. When's the last time you had the last fusion?
I had 7 of them all together at one time 3 years ago.
Okay. And you still have pain?
Yes.
Yes. Okay. All right. Anybody else? Thank you for sharing. That's good. Come on. Don't be shy. Thank you.
I was diagnosed with sciatica since February.
Okay.
And I have not gotten any better. I've been through what you just mentioned, the whole 9 yards. And it's getting worse, and I am feeling no relief at all. And, I just continue to go through the motions, and I'm not getting any better.
Frustrating.
In fact, it's worse. It's worse at night when I go to bed. The pain is not getting any better. It's worsening day by day, week by week.
Yeah. Changes your life quite a bit.
Yeah. And I don't know what to do about it. I've been through everything except for the surgery.
Right.
So,
I'll shed some light on you. So I wanna hear more stories. One of the things you see on here is Fellow of Applied Functional Science. So I went to graduate school, got a doctorate, and then I continued on to specialize and become a fellow in this certain type of treatment. And the certain type of treatment is called applied functional science, but the idea is that our healthcare system is so focused on treating the symptom of pain, they don't take a global perspective on the entire body, and they don't find dysfunction. So we'll talk more about that, but it's gonna fit right up your alley as far as, gosh, I've had all these symptom treatments to try to make my pain go away, but nobody's tried to find the root cause of my problem.
Exactly.
That's really what we're trying to talk about today. Who else has got some good stuff?
August, I had decided, woke up one morning for a walk. I resorted to and found, thank God, a chiropractor who does active release therapy. I didn't resort to the medical realm at all. I did homeopathics and active release therapy and chiropractic. It took about 2.5 weeks. I'm doing a lot of stretching. I want to know more, so I don't ever have to experience that again.
It's not fun.
None.
It's not fun. Thank you for sharing. Guy back there had a nerve.
I was diagnosed with spinal stenosis and had the surgery 19 years ago. Very successful surgery, and now things are starting to hurt again, and I went back to the same surgeon who said my spine had fused itself and is getting crooked because of that, good and bad.
Yeah.
Didn't think he could help me. I wrote to Mayo Clinic and was refused.
Okay. So I didn't want to see it. That's disappointing. We'll talk about spinal stenosis in a lot of detail. So we'll go there for sure. Yes?
Yeah, I had several horseback riding accidents, plus falling down the cliff.
Sure.
And then I had cervical stenosis surgery, and recently I found out I had a fracture at C1 level.
Okay.
But that pain was all up and down, plus arthritis all over my
Sure.
body.
We'll talk about the spine kind of in a general aspect too, so what applies for the lower back will definitely apply for the
So I'm
neck.
still having a little bit of pain
Sure.
in my neck. It's been about a year since I've had the surgery though too.
Okay. We'll talk about that for sure. Thank you. Who else?
I'm a runner and a biker and a cross-country skier.
Okay.
And I tore my hamstring here about 2 months ago. And it migrated up to my second case of sciatica. And I'm here to try to see if I can accelerate that healing and mending process.
Absolutely. So that's a good point too. You're talking about a hip injury that then feeds into a back injury, which is, we'll talk about that. Absolutely. We'll shed some light on that.
I had a back fusion, L4 to L5, 5 years ago, and 4 years later I had to have another one, L3 to L4. And I went out to Arizona for the winter, get away from the ice and snow. And in my block, there was two people that have had similar situations in 4 years of repeat back surgery.
Yep.
And when I went to the physical therapist out there, he says, well, it runs from 3 to 5 years.
Yep.
And I'm kind of wondering if there isn't a way to elongate that a little bit.
Yeah, I would say that the statistics right now, the research shows that spine surgery is successful 50% of the time, 2 years out. So flip a coin, right? So we'll talk about that too.
I have no pain in
That's good.
between the two.
That's good.
And I just want to keep
Keep it going.
ends from becoming distorted again.
Absolutely. There's only so many you can do, right? 7? There's only so many you can have, right? So there's a limit there. So we'll talk about that too. Thank you. What else we got? We'll get you next. You got it. Yep.
I got mine from weightlifting.
Okay.
I've never had a problem with my lower back at all, and now I do because I lifted too much, and not only do my hips hurt and center of my back, but now my legs feel like they weigh about
Sure.
500 pounds apiece.
Sure. That's frustrating too, because you're doing something, you're trying to be healthy,
Yeah,
and then you hurt yourself.
right.
So that's actually kind of part of my story there, too, really frustrating. You know, and the point of this process, I think it's really good to hear people sharing their stories, because I remember when I was there, it felt like I was the only one that understood it, right? And so that was the thing I think that affected my life more than anything, was that the pain was so bad and no one got it. And so I think it's important to hear that there's other people that have stuff going on, that, you know, there's gonna be some really common, a lot of commonalities today. There's gonna be a lot of things you're gonna recognize. There's patterns, there's, you know, what I call the 80-20 rule. So 80% of the low back that we see is really only 20% of the possibilities. So there's a lot of patterns that come up with people, and you can really do a lot by talking to a big group like this. I saw another hand come up over here. Yeah.
I'm a walker, I'm always
Okay.
love to walk, and, a couple of years ago, I was in a car accident, and fractured my sternum, and it's had affected everything.
Sure.
And, I think one of the biggest frustrations is people look at me and say, well, you look fine.
Right. Yeah, nerve pain is hidden, right?
But walking to the back of my arm,
Yeah. Is it more here, or is it more back here?
it's mostly low back,
Yeah.
occasionally, and I still feel like it.
Yeah. So, but that was the original part right there that you heard. That's gonna make a lot of sense when we get into towards the end here, like the 3 common causes of this stuff. It'll make a lot of sense. Yeah, in the back there.
I do a lot of heavy lifting as far as, I'm a cabinet installer,
Okay.
and a lot of awkward extension type lifting.
Sure.
And I have a bad lower back right now, and like this sciatica problem going all the way down to my ankle.
Yeah.
I've been seeing a chiropractor for 3 times a week for like 3 months
Sure. Yeah.
now. Decompressioning every time. I've
Just
got,
there for a couple hours and then.
yeah, I'm there for at least 2 hours.
Yeah.
And then at home, I'll lay on a bed, you know, inverted, real careful. That helps out, but I wake up every day at like 4 a.m. I can't sleep. Well, this, I don't want surgery. I'm the sole provider for my family, so I can't be out of work. Will this eventually heal or fuse somehow and go away to a certain degree? Because I'm in excruciating pain every single day, all day long.
We'll talk about that.
Okay.
We'll talk about that for sure. And that's the number one question, right? Is it gonna ever get better, you know?
Right, pretty
That's
much.
the key. I was a roofer too, by the way, so that's part of my story there. So the manual labor, the bending, the lifting, you know, beats it up. Andrea.
I'm glad I followed yours. I can identify with that, I can identify with weightlifting stuff. I've been in physical rehab from a motor vehicle accident 20 years ago. I've had my fair share of stretching, actually get stretched 5 times a week, as well as do my own stretching. I saw Andrew as physical therapist, let me say, 4 or 5 years ago.
Yeah, something like that.
And he taught me a lot, and I had a brain injury and need a reminder, and needed to support Mom. And so here I am.
Yeah.
And yes, it can get better. And I've gone through the decompression treatment and chiropractor,
Sure.
you know, frequently, and so, yeah, muscles play such a huge role.
Yeah. I think the key is identifying what
Yeah.
type of back pain it is first the most important thing. And then identifying what you're having a hard time with. And otherwise, if you're doing, some treatments are gonna make you worse. That's the idea. So thank you, Andrea. I appreciate that. It's good to see you.
Bye.
And nice to meet you, Mom. Anybody else got anything good they wanna share? Yeah.
He didn't plant me here. Andrew saved me from having surgery. I had sciatica, really bad back, was just in a chair. I couldn't even have the MRI because I couldn't lay flat. And I tried a different physical therapy place, and got worse, and I finally found Andrew and King. And then I got well enough to have the MRI, and found out I had a bulging disc. Went to a surgeon, told the surgeon, I really don't want surgery, but I want, to tell me what. And he said, well, let's keep going for a while. Anyway, my foot dropped, I actually had a dropped foot. All that through Andrew got better. I'm here today because occasionally, sometimes I'll feel a twinge and I'm lazy on my exercises and I want to stay well. But it does work what he's telling you.
Thank you. Not the idea today to self-promote, but thank you so much.
Yeah,
I
you
appreciate
didn't
it.
plan me, seriously. You didn't know I was going to say anything.
Appreciate that, I appreciate that. Yeah, you know, the surgical idea, no offense to surgeons, but I think the idea there is if I am a carpenter and all I have is a hammer, everything looks like a nail, right? I say that analogy a lot because I think it's important to have a lot of different tools, try a lot of different things, and, you know, if one more person's out there just dying to tell the story. Oh, in the back, all the way.
My husband had cages put in Ann Arbor 15 years ago because they didn't do multi-levels in Traverse City then.
Sure.
So went through that, and now he has a back stimulator,
Okay,
nerve stimulator,
all right.
and he just went through a 3-week bout of sciatic pain, and
Yeah,
so we're ready.
all right. We'll hit on that a little bit too. Thank you. All right, I'm gonna share my story. So I was 24, it was my last semester of undergraduate, so I was going into graduate school, and I needed to finish out my last semester. And right at the beginning of my last semester, it was like the fall, I was at Marquette, so very active, weightlifting. I was roofing in the summer, and I was in a mountain biking class up there, and it was getting towards the end of the season, and it was a really intense class. I don't know if you guys have ever been up there, but very rocky, very mountainous. And I was riding my mountain bike, and I went to jump off a 3 or 4 foot kind of cliff dealy, and when I came down, my butt hit the seat, and you're supposed to lower your seat down when you're doing the downhill. My butt hit the seat, and it kind of compressed my spine, and I was fine at the moment, but I woke up the next day with burning, shooting leg pain all the way down to my toes. Didn't actually have any back pain, it was all in my leg, the sciatic pain, right? And so I went through about a year. Well, let me back up a second. So usually when you have an injury like that, it's not really the injury that did it. It wasn't anything that was that unusual. It's usually a series of micro traumas, like bad movements for a long period of time. When I think back on that, I had back pain all the time, but it was just kind of something you dealt with. You didn't really think it was that big of a deal. So I can think of about 3 years of back pain on and off, whether it was during work or whether it was in class or whatever it was. So that moment was the moment I had that kind of set me over the edge, but that wasn't the problem. That was just like the ticking time bomb. I wasn't handling it, and we'll get to that in a second. I was kind of ignoring it. And I was healthy, I was in good shape, so that was frustrating. But, so then I get into the system, right? So I'm a student, I go to the university center doctor, and what do I get? The first thing I get is Vicodin, right? So that's nice. Vicodin and ibuprofen, prescription ibuprofen, which is nice, because that's not different at all than the stuff you buy in the store. But it's twice the price, so. And of course, I don't have very good insurance because I'm a student, so I think my policy was $1,000 deductible with a 70-30 policy, so I had to pay 30% of all this. And I'm a college student, so, I've accumulated $120,000 in debts, and the whole thing, but at that point, I was probably only $40,000 in debt, So, I go in, I get the pain medication, I start to have to go back every 30 days to get the new pain medication. And I think it was the 3rd month, the doctor started to question my honesty on whether I was really in pain, because there was, whether his exam was good or not, I don't know, but, so what I did on the 4th visit was I stopped taking my pain medication, and I went in there, and I said, look at me, I'm dripping in sweat. I mean, it's the worst pain I've ever had. He wasn't going to give it to me. I got pretty angry, and so anyways, I got more medication, but then I got a referral finally to I think the first step was a chiropractor. And I go in and I get like 3 adjustments, and I'll tell you what, that made me feel 10 times worse. The pain now is in my back and in my leg. So I stopped doing that, go back in after my medication is up, and then I get a referral to a physical therapist. And the healthcare system in the UP is not the greatest. So I go into this physical therapist that went to school about 25 years ago, and I've got this style of therapy called McKenzie therapy, which is a combination of spinal decompression, where you sit on a table and they pull your spine apart, and exercise, where you're strengthening your legs. Without going into too much detail there, that didn't do a whole lot for me. And which is disappointing, because I'm going into physical therapy, right? So I'm thinking, gosh, this is pretty sweet. It's not even helping me, so, and then the explanation I was getting too from the therapy place I was at was not very good. I felt like each time I would see somebody different, I would get a different explanation of what was going on. And at the same time, I'm studying this stuff too, so I want to know, and I'm getting different answers, so I could tell right away that something was disconnected. So then I go back in, and at this point now, I'm 4 or 5 months into the process, and the pain is terrible. I can't sleep. Throughout the whole year that I had to go through this, I gained 35 pounds. I missed an entire semester of classes. I did not see my friends. You know, it's the last semester I didn't get to hang out because you can't go out and drink beer when you're on Vicodin. You can, but it's not that good of an idea. Right? So, you know, then I finally get an image, I get an x-ray. So, you know, an x-ray was the first step, which shows my spine looks normal, right, because I'm 24 years old. So there's $800, right, and we could go through the list of the pricing on this too, but, you know, then I think I went back to the physical therapist, massage therapy, acupuncture, then it was injections, right, so I get the cortisone injection in my lower back. And I think the first one did nothing. You go back in and they say, well, we'll try 3 of them. They're $800 a piece, so I had to try 3 of them. The third one didn't do anything. And so then I got an MRI. So the MRI was like $2,300, I think it was. And at this point my deductible's met, which is nice, but I'm still paying 30% of it. And this is what I mean by the system. You know, you're getting the system. And so I get the MRI, and the MRI reveals I have a severe disc herniation in L4, L5. And I go and then I get a consult with the neurosurgeon. And this is the funniest part. The neurosurgeon comes in the room. I've got a list, right? I've got a list of things I want to know about. He goes, all right, my name is Dr. So-and-so, when are we doing surgery? And I just kind of said, whoa, like, are we going to talk about this? Are we going to have like some, an opportunity to talk? And he said, well, by the time you get to see me, you need surgery. So what are we doing? And I'm like, that's not at all what I was here for. I want to know, like, what are the outcomes and, what is the surgery like? Like, what are the risk factors? And he just said, you know what, I don't have time right now to talk about that, so when you're ready, give me a call. You'll know when you're ready. That was it. Not even joking. We'll talk about that in a second, what the outcomes were. So the nurse comes in, and I was like, well, this is ridiculous. So, and I think there's only 3 neurosurgeons in Marquette, if that. So my options were limited. My family was recommending I go somewhere else, but the problem is I couldn't ride the car. So to get me to ride 7 hours down to Grand Rapids from Marquette was pretty much impossible. So we'll kind of speed the story up here. I waited another 3 months, and what happened to me was I started to the pain medication wasn't working, so I started to double up on my Vicodin, and then it was doubling up in a half, and my life was run on a 4-hour clock. I could tell you what time it was based on my pain level. So I remember with my wife now, we were dating at the time, we were getting food at a restaurant called Mango's in Marquette, and I forgot my pain medication, and sure enough, the 4th hour hits in, and I start to sweat through my dress shirt, and I just get up and I'm like, I have to go, and I had to leave, and our food wasn't even there yet, and I just left. I left her there, and I had to go home because I was in so much pain. And then about a week later, now for all you guys, we weren't married at the time, but she wakes me up in the middle of the night. Well, I had just fallen asleep, and she shakes me, and she goes, you're not breathing. She's like, you're taking like a minute and a half between breaths, and then when you're breathing, you're gasping for air. And what was happening was I was taking so much Vicodin that I was about to overdose on Vicodin. So she woke me up. I mean, thank God she was there. She gets me coffee. She makes me stay up all night. And then in the morning, she makes me call the surgeon. And then I think that was Sunday night, and by Wednesday, I was in there having surgery. When I say I've been through all of it, I really have been through all of it. And I did need surgery. I mean, there's no doubt about it. And when you look at the statistics for disc herniations, 85% of people are able to heal the disc herniation, but there's 15% of people that can't. And I would argue, though, that I'm not sure that I was in that 15% of the population because I didn't get the right treatment, and we're going to talk about that in a minute. Because 2 weeks later, here I am now, I'm a month from starting graduate school, and I just had surgery. The surgeon says, do nothing for a month. Absolutely nothing. You can't even lift more than a gallon of milk, so I do nothing. I go from my bedroom to the kitchen to the bathroom for a month. And 2 weeks into that, my leg is on fire again. And I go back into the surgeon, and this same guy, by the way, that told me that, when you're ready, you'll call me, gives me a lecture about, because I had to get another MRI to see what's going on. And he gives me a lecture on, what did you do? This herniation came back in the same spot. That never happens unless you did something wrong. You didn't listen to me. And the funny thing is I didn't do anything, and I was very safe, and I was very motivated to get better. And you can't even have surgery now because you have to wait until the scar tissue forms, and you have to wait at least 6 more weeks, and blah, 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 blah. So I went off to Central and started graduate school with a new disc herniation in the same spot. And the cool thing about that, though, is that I became the guinea pig. So I couldn't sit down, so I was standing in the back of the class, and, you're surrounded with 50 other physical therapy students and, 13 professors, and so you become the guinea pig. So I learned a lot about low back pain, and I think my personal experience, gave me a lot of empathy for patients, and, but the surgery didn't work for me. So that's when we got into this newer type of physical therapy, the non-traditional, or I would say the more progressive. It's a lot different than it was 20 years ago. 20 years ago, for low back pain, they used to put you in the hospital. Has anybody had low back pain 20 years ago? They used to put you in the hospital on traction for 2 weeks. Did you ever experience that?
I was an orthopedic nurse,
Okay.
like, more than 20 years.
Yep. So they would put people on traction, right?
Oh, yes, yes.
2 weeks, you go to the hospital.
Put the weights on and
Yeah.
take them off.
And these were like crazy traction machines with like weights, like where they're hanging on pulley systems, and it looks like you're the mad scientist in there. 2 weeks of traction in the hospital doing nothing. The research now overwhelmingly shows that is the exact opposite thing you want to do with somebody. It's the worst thing to do. So 20 years ago, we were doing actually the worst thing for people. And so that's my point, is that traditional therapy, which a lot of the stuff around here has changed a lot. And so if you don't see a wall full of degrees and certifications, then people are missing the ball there, because stuff has changed quite a bit. So that's what I'm here to share with you. Really kind of, long story short, I become the guinea pig. What they find out is the therapists, the professors find out like the first day that we were actually doing a hip, see in PT school they go through regions of the body, so they start with the foot, the knee, the hip. So we're like 3rd week in and we're talking about the hip. And like the whole week is set up, it's like anatomy, physiology, all the conditions that can happen, and then the treatments. So they throw me on the table and they look at my hips, because they're like, well, you've got to have something going on, because you're you can't even sit down, so let's come over here. And they find out is my right hip doesn't move at all. It doesn't rotate whatsoever. It had 0 degrees of rotation, when the other side had about 60. And it also didn't have any extension. And so my hip was not moving very well. And so we started to work on my hip that week. And guess what that started to do? It started to make my back feel better. And so that's really the premise, or the idea that where your site of pain is not always the source of your pain. And I would say more times than not, like 95% of the time, it's not your lower back's fault. But yet, the entire medical community with injections, massage, chiropractic, even physical therapy, and surgery are all focused on the lower back. The lower back is an intersection where everything from your hands wiggling and your head moving to your feet wiggling affects your lower back. So we have to look at it from kind of a more global perspective, and that's what we're going to share with you. Does anybody have any questions about my really long story?
Do you know the reason why this first surgery didn't work, why it failed?
Because simply walking, when you walk, every time you take a step, your back hip needs 35 degrees of rotation inward. I had 0. So every time I did that, my back was rotating. It was twisting what was supposed to be healing disc herniation. And so it's like a cut knuckle.
Okay.
If you, what do you not want to do with a cut knuckle? Bend it, yeah. So I was basically moving it too much, just walking, right? The precautions were no bending, twisting, lifting, but no one said I couldn't walk, right? So that's really why. I mean,
Are you out of pain yet?
oh yeah. Yep. I haven't, it took me about a year into grad school, maybe a little less than that, until I really started to kind of begin to self-treat myself, and the therapist and the professor helped me quite a bit. So,
Why did you not have any rotation in your hip?
that's a great question. I think it's because in high school I injured my hip in baseball, and I think I have what's called a labral tear.
What was the question?
She had said, why did I not have motion in my hip? I don't have a definitive answer, but I look back on, there was an injury in high school, and I had a rotational injury where I remember there was severe pain, and now to this day my hip clicks and I have to work on it a lot. And usually when you have clicking with a little bit of pain, there's this structure around the hip socket called a labrum, which is like a meniscus in the knee, or you have one in your shoulder too. But it creates, it makes the socket of the hip more deeper, so that there's more congruency. I'm pretty sure I have a tear there. But my motion's good now, I just had to work on the motion. So really the answer is I was unaware of the lack of motion, is why I had no motion. So it's use it or lose it. And my body was not using it because it was trying to protect itself.
that you had no rotation, you wouldn't feel that at all? You
I see
wouldn't have
people,
walked weird, or?
we see about 350 people a week, and I can tell you that rotation is one of the things people lack the most, and most people aren't aware of it. Yeah.
What did you say that right ring was?
It's like a cartilage ring.
It's a cartilage
Yep,
ring,
yep.
okay.
So rotation is not just the movement of your legs? Just walking?
Rotating in and out.
So that's a good question. Our bodies are designed to move in 3 planes of motion. So the first plane of motion is front to back, so my hips you can see that very easily. The second plane of motion is side to side, right? So you can see my hips moving side to side. The top one to see is rotation, right? So that's the third plane of motion. So every time I take a step forward, my pelvis is one circle, right? So in order for me to go forward and continue to be connected to this leg back here, there's an amount of rotation that happens there. So not the easiest thing to see, but if you ever go to, if you ever get a chance to watch people from an elevated, if you're like on a bridge looking out, people you'll see them, they look like the little twisty little wiggly worms. Yeah, it's kind of cool. Okay, so here's where we're going to kind of get to the meat and potatoes of it. This was for earlier, my little joke, my Halloween group therapy. We shared our story. I appreciate you guys doing that. My favorite one is the pumpkin. I feel hollow inside. or the head. I feel disconnected. Okay, so I told you my story. I told you about the surgery that I had, and I didn't go back for surgery, by the way, which was cool. So that makes me think in my mind, why? If I would have had the right treatment, could I have avoided it in the first place? I mean, if I avoided it the second time, it makes sense, right? So what are you going to get today from me? For attending today, part of the registration form and is to get your email address so I can send you the book I wrote. It's an ebook. I haven't published it yet, and it's like too many pages to print out, so I'm going to email it to you if you haven't already gotten that online, but I'll send it to all of you today. And it really does kind of summarize what we're going to talk about in maybe a little bit more detail too. I got a report that I'll hand out at the end. It is that we surveyed 3,400 patients that have low back pain, and we wanted to know their questions. So we compiled a list of the 10 most common questions, and we answered them. So that will help you. And that was about sciatica specifically. And then we're going to talk about the top 3 causes of back pain, and then we're going to talk about the top 3 treatments for back pain. And I've got a really cool handout that I'm going to give you that also goes a little deeper, and it has the top 3 movements for the condition that's the most common, the 3 conditions. So we've got them categorized. And so I'll give you that if you want the handout too, so you can begin to try some of these very safe movements that hopefully will be positive for you, or you can share with friends. And there's also videos associated with them. So we kind of talked about this during the stories. You guys listed a bunch of things that are difficult to do. This is kind of the order that I see, most common to least common, but what people have a hard time with when they're backwards. By far the most common thing is walking. You had mentioned that earlier. The second is standing, the third is sitting, and then running, bending, twisting, working, laying, raking, and shoveling. I probably should throw in vacuuming. Vacuuming is a really, really common one that people have a hard time with. So that's a lot of stuff. It affects us. I didn't throw this in here, but 89% of the population in the U.S. will have lower back pain for more than 3 weeks in their lifetime. So I mean, that's a pretty crazy amount. We could get into that whole conversation about, really, this should be taught to, we should be 3rd graders in here talking about this stuff, because if we did it then, we would avoid all this stuff. But maybe someday. So, but the most common thing that I wanted to point out with all those activities is that the pain is reproducible. That's actually a good thing, because that means if the pain is reproducible, we can reduce it. If you're sitting here and your pain is constant, there's a lot less of a chance that physical therapy or any treatment is going to help you. And I know that probably bums some people out. That doesn't mean all the people, but if your pain, maybe I should rephrase that. If you can make your pain get worse with movement, it might hurt all the time, but if you can make it change with movement, that's actually a good thing, because that means that movement can help you make it go away. Yep.
Mine gets better with movement.
That's exactly, you're perfect for this. So that's good.
I can stand up and work for 8 hours, and it hurts.
Yep.
But as soon as I chill out,
Yep.
I get numbing,
Yep.
starts to ache.
So that's actually a really good sign, though, because if it didn't change with anything, whether you were resting or moving, whatever, if it stayed the same and never changed, that's a bad sign. And that's more likely to be a surgical candidate. That's actually more likely to want to get more assessments because there's a lot of other scary things that could be happening. But for the most part, we see people that have pain that can change. And when we see that, we work with them. When we don't see that, we tell them, this is not for you. We tell them right at the beginning because you don't want to waste your time. Does that make sense?
Mm-hmm.
Okay, so the phrase there is reproducible pain is reducible pain. So there's three ways that we can deal with problems, right? I think it's important just to say that, though. I mean, the first thing we can do is ignore the problem. You know, either taking the thought process that it's just going to go away, or maybe even like the self-fulfilling prophecy, like it's just who I am. I'm bad at math. That's who I am. Well, the reality is I'm bad at math because I don't practice math. It's not because I'm just bad at math. You know, so you can have two different mindsets there. So we can ignore it, we can alter it or change it. And the analogy there would be like I can medicate it, I can inject it, I can massage it, I can heat it up, I can cool it down. Those are altering it, changing it. I can get up and not rest. You know, those are the ways to alter it. Or we can handle it. That's the third way. So one of the analogies they had that I was reading about was, you know, you can have a fire in a building and the fire alarm's going off. You can cover your ears, but that doesn't change, that doesn't handle the problem. That just alters the situation. You feel more comfortable. But yet we do that with a lot of treatments. It's not just back pain. We do that with heart issue. You know, we take a lot of things in the medical system. We're just altering it. We're changing it. We're not actually handling problems. I've got a quick story. We were in our old facility. I don't know if you guys remember. We were at the Commons the first 2 years. And it's a much smaller space, very hard to find, lots of stairs to get in. And we had a leaky roof. And we called the roofer. They came and checked it out. It's not the roof. It's the HVAC. We call the HVAC guy. He comes in, he says it's the roof. We call the roofer back. The roofer says it's the HVAC guy. Finally, we just said, okay, this is enough time I've spent, so I'm just going to change the ceiling tiles out. I'm just going to keep changing the ceiling tiles because we've got extra ones, right? It's not my building, right? What happens? One day we come in, the clinic's flooded, right? So now we've got to shut the clinic down. Very costly, $30,000. Very comparable to a back surgery, $30,000 to $50,000. So we didn't handle it. They didn't handle it. We didn't handle it. That's a really good example of like why it's important to handle things. So the biggest question that I have is, are we treating, even when I work with people, are we treating the symptom or are we treating the dysfunction? And that's sometimes really hard to figure out. But I can tell you that the symptom of leg pain, numbness, tingling, weakness, even lower back pain, those are symptoms. The dysfunction that needs to be discovered. So number one mistake in that is we'll ignore it. Number two mistake is that we treat symptoms. All those things listed that we've talked about, even activity avoidance is a symptom treater. You know, we don't, those are important. We have to have some symptom treaters because we need to feel better. But if we want to find a solution that's permanent, we cannot continue to focus on the symptom. So this is where it gets fun. So we've got, of the 70% of low back pain that we see, and really the statistics nationwide, there's three major types of lower back pain. One is herniated discs, two is stenosis, or called degenerative disc disease, or called arthritis. Those are all the same thing. So stenosis is the most common thing that you'll be referred to. And then the third is SI joint pain. Now there are some other types of lower back pain, but these are the three most common.
What's SI?
SI stands for sacroiliac. We'll talk a little bit more about it, but it's where the pelvis meets the sacrum. So it's like the bottom part of your spine. Okay? And then there's sciatica, right? Everybody seems to be very familiar with the term sciatica. Sciatica doesn't mean anything. Sciatica is an umbrella terminology that doesn't help anybody. It doesn't diagnose, it doesn't come up with a dysfunction, it doesn't even really come up with a symptom. Because sciatica could be numbness, tingling, weakness, shooting pain, dull pain. Sciatica is a terminology that is used to describe when the sciatic nerve is irritated. Okay? It doesn't tell you why, but just to give you some information, the sciatic nerve is the largest in the body. It's about the size of your thumb, pretty big, and it is actually 5 nerves. So it's all the lumbar segments, the nerves that come out of the spine. the nerves that come out of the spine, you can see on that right side, there's little nerves that come out of these little holes in the spine. They come together and actually form one big nerve. And then they go right through your butt right here. You can see that they combine with each other and they form this big fat nerve. And that puppy, when it's irritated, it's not fun. You need to go back here. So again, pain, tingling, numbness, weakness. Weakness is probably the worst thing to have. That's actually when the surgeons become more motivated to give you surgery, is when you have what we call foot drop, or when for me, my toe stopped working, so I couldn't wiggle my big toe. The reason that becomes kind of an emergent situation to actually get surgery is because the longer you let that happen, the more likely that you're not going to get that back. So in that case, that's when you say to somebody, you know what, it's too late, you need surgery. Another really big red flag would be, that I didn't list here, but would be changing in your bowel or bladder. So if you had incontinence or the inability to go or to control your bowel or bladder, that can be because of sciatica or irritation. And that's, again, another red flag that surgery has to happen, regardless of whether you want it or not. You have to have it. So that is the sciatic nerve. So, yes?
I didn't see, movement of the vertebrae itself up there. Is
That's
am I missing something?
No, that's not the three most common, but that's definitely, like I said, there's other reasons why. You're talking about a condition that's called spondylolisthesis. You have to remember that one, but there's a lot of other things, but this is about 80% of the people we see. Okay. So, but if you have that and you want to hear more about it, we can talk about it at the end. I would definitely be willing to share some stuff with you. But there's a lot of things. You have fractures, you can have other issues here, but we're talking about the three most common things. Yep. Foot drop would be like when sometimes people call it foot slap, but instead of just quietly walking, it'd be like, and I wouldn't be able to control it, my foot would just slap. You see it a lot with people that have strokes, or in this case, sciatica.
Can you talk a little bit about what causes the foot drop?
So the nerve when it's compressed, and sometimes it's physically compressed, like a disc herniation, and sometimes it's compressed by fluid, so inflammation is the most common. It's like a fiber optic cable. So imagine the cable, and the fiber optic cable has a bunch of different colors, and those colors have different signals. The nerve is the same way. It's got signals like strength, sensation of hot and cold, balance, but the strength, so depending on what fiber is compressed, if the strength fiber is compressed, it's going to make the muscles not working that the nerve goes to. And so that would be the muscle that controls your foot. And the reason that foot drop is so common is because 75% of disc herniations are L4, L5, that bottom level, and that actually controls a muscle called the anterior tibialis in the foot. So it would make you slap your foot or not be able to wiggle your big toe. It's a good question.
Is that the same as, I've been having trouble occasionally, I'm walking along or going downstairs, all of a sudden I just lose control of it.
Yeah. Yep.
It's the same symptom.
Yep. So if that nerve gets compressed, you don't even have to have pain, it just be weakness.
Yeah.
So yes.
I didn't, at that instant, I didn't have any pain.
Yeah, it just buckles out. Yep. Yep. So the point there though is that sciatica could be referring to any one of these three. That's what's important to identify here, is that it doesn't help us fix the dysfunction. It just is talking about a symptom. So that's why we call this the lower back pain and sciatica workshop, because everybody knows the sciatica. It's kind of like when they say, oh, you've got arthritis. It's like, well, it doesn't really mean anything. It doesn't tell me anything. Like if I have knee pain and someone's got arthritis, it doesn't mean that that's why they have pain. This is, again, another visual of the distribution of the nerve. So we know that sciatica is going to be in the back of the leg. So from the butt down to the calf, and then it usually wraps on top of the foot. If the pain is on the bottom of the foot or more in the groin, that's when we talk about different nerves. That's more like SI problems, and we'll talk about that. But that probably looks familiar to some people here. So let's talk about, most of the people in this room are going to relate more to stenosis, but let's talk about the other two first, and then we'll spend a lot of time on stenosis. So the first one is herniated discs. And the reason that I said that most people in this room aren't going to care too much about this is because statistically, 85%, I believe it is, or maybe even higher, of disc herniations occur before the age of 34. Right? right? So I don't see a lot of people under the age of 34 here, right? So, and why is that? Well, because when we're 34 or younger, our disc material is like crab meat. Okay, if you were ever to do like a cadaver dissection, you would feel it's like crab meat. It feels just like it. And when you squeeze it, it moves. And so if it gets squeezed, it will displace itself. After the age of 35, that disc material starts to turn into leather. So now, after the age of 55, it feels like leather. It's not very pliable. It's not going to move very much. It's shrunk a little bit. It's not as squishy. It's not as shock absorbent. It's not there. But so most of the people in this room, I would rule out a disc herniation. But the funny thing is, everybody wants it to be a disc herniation when they come in. They all think that because that's the most common surgery that we see, right? So the disc material has two layers. One is this outer ring. It's called the annulus fibrosus. It's kind of like a cover. And the inner ring is this nucleus pulposus. I won't ask you to remember these. Don't worry about it. It's not a quiz. But the point is that outer ring is kind of thicker, but the inner ring is that crab meat. And what happens when a disc herniates is that outer ring tears, and the crab meat shoots through the tear. And the outer ring has to be torn, and the outer ring is torn through movement. And there's two movements that are shown to tear that. 20 years ago, they used to think that it was the forward bending, and which is true, but 7 years ago, this anatomy professor was doing some research and found that the force to tear the outer layer of the disc is significantly less with rotation. That's where the hip thing comes in, right? So if I can easily tear that disc on the outside and cause a disc herniation by rotation instead of bending. Both of them can, but what we used to know is maybe not as accurate. So signs and symptoms would be, and this is really important, 35 years or younger, pain that increases with bending forward, but also coughing, laughing, and sneezing. That's the really, really key factor there. Because when I cough, laugh, or sneeze, what happens is that the intra-abdominal pressure gets higher, and my spinal cord is covered or surrounded by fluid. It's called cerebrospinal fluid. And when you cough, laugh, or sneeze, that fluid gets pressurized, and it will start to cause that disc material to push out even more, right? There's also one more I didn't list here, which would be pain that's worse in the morning. So that fluid is more pressurized in the morning than it is at night. And that's how you can really differentiate between stenosis and arthritis, because typically it's what I feel worse as the day goes on. The more I stand and walk, it hurts. We'll talk about that in a minute. But can you heal this? Absolutely. Statistics show, and these are large statistical studies, they're called systematic reviews, where they take all the studies that are out there and they look at all of them. And they came up with 85% of disc herniations are healed within 6 months doing physical therapy. Okay? 50% was surgery. And then we did a survey of the area physicians, and 78% agreed that the disc herniation can be healed. We kind of did that as more for our purposes, just kind of getting the awareness. I wanted them to recognize it can be healed versus making that referral to a neurosurgeon like that.
When you say it's healed, does that mean it goes back into the?
It doesn't go back in. But what happens is it scars down and it recedes a bit. Right. And really, there's even more evidence now to show that it's not even the disc material that's causing the pain, but it's actually the fluid that's leaking out. And the body does not like cerebrospinal fluid in it. And so what happens is it attacks the fluid with inflammation. Yeah, so there's some other conditions in the body where the fluid leaks out and the body does really bad with that. I don't know if with women in childbirth and epidurals, where they go too far and they puncture the epidural sac. That's a good example of that, where they get headaches and they get some stuff going on. It's not very good. The body basically attacks that fluid. So it does heal over. It kind of closes the hole. But a little interesting tidbit here. If you were to MRI 100 people off the street, 60% have a disc bulge or herniation, and only 10% have pain. These are random people. So it's not just the actual disc pressure, but it's actually that tear and the fluid that's going out. And then I'm just gonna throw a couple of these in there, because I think it helps to hear other people's perspectives, but we had a guy that came in and here's what he said. So, came to Superior, I had been receiving a series of injections for my back pain and loss of nerve function in my legs. I was in considerable pain and skeptical about resuming PT, since my experiences at other providers have been mostly ineffective. Once I started at Superior, I quickly realized that they had a different approach than other PTs I worked with. We started with working very gently with mobility, working in multiple planes of motion, which mimicked real life. Soon I was, much to my surprise, more mobile than I had been in a very long time. I also started to gain confidence, and my fear, which is really important, of re-injury was greatly reduced. After moving into more stability work, I noticed that my flexibility and mobility were being sustained, while my core was greatly strengthened. I even lost some weight. That's great. So somebody who did well. You know, I think we try to highlight people that do well, because I think when you're doing this alone, you don't know that it's possible. So let's talk about, any questions on that, the disc herniation? Yes?
That's exactly me.
Yeah.
Mine is, L5S1,
Okay.
and I've been dealing with it for 8 years.
Yeah.
I had one injection, and it worked really well. I went and had a second injection 2 years later, and it didn't do anything, and it was a contaminated injection.
All right. Yeah, so if you guys didn't hear about that, there was, a couple of years ago, we were one of the cities in Michigan that had, 2012, we had meningitis, contaminated from a company out somewhere, I can't remember what the company was, but.
Massachusetts.
Yeah, so not good. But there, you know, there's risk factors with all of this stuff.
And I've been in physical therapy, and nothing has helped.
Yep.
yet,
So what I want you to do is, as you're going through this, when we start to get to the treatments, I want you to ask yourself if you have had somebody focus on those areas. And that'll be the key. And if the answer is yes, you know, that's not what I'm trying to do, is say that this is for, you know, that's statistically 15% of the people need to have a surgery, right? So, and I was there too, so, but I want you to, as you're going through this, ask yourself, did I have that or not?
And I don't want surgery
Yeah.
if I don't have to.
Yeah.
And I actually went and saw a surgeon before I got the injections, and he said I was too young and not bad enough to have surgery.
Sure. Yeah, my side note, my first patient ever, I was up in the UP, I was doing clinical rotations. I had same surgeon that did my surgery. I was in Bell Memorial Hospital over there by Teal Lake, and the first guy I ever met as a student, physical therapist, he comes in and I'm looking at his chart. We had the same surgeon, same disc side, same everything, and the surgeon had slipped and cut his sciatic nerve. So his leg was didn't have a leg, it was moving. So there's always risk factors. I mean, not to scare you, but everything that we do when we're doing this stuff has risk factors, especially when you start to get into some invasive treatments. I saw another hand come up about, yeah.
I just wondered if any of the products that are on the market that claim to add the flexibility, the pliability to the joints and specifically that leather-like thing.
You mean like supplements?
Yeah,
Yeah.
actually do any of that.
You know, there's, I would say the homeopathic stuff, the supplements, if it truly worked, the pharmaceutical companies would be all over that.
It's easier to say.
So, there's a lot of stuff out there that's, you know,
Claims.
a lot of claims. Yes,
I don't want that, bro.
okay, yes.
It's watching you move around like you do. And you're not hurting,
Yeah, yeah,
right?
yeah.
We'll get better eventually.
How the hell do you do that? I'll tell you, I learned more about
Too much
what
coffee.
you're, I can't hear a damn thing.
I think we can read, right?
I can see, but it's your movement and the way you act, you know, something's gotta be right, I guess.
You gotta have a little humor there. All right, so let's talk about the SI joint. I would say for this group, this might be the second most common thing that's going on. Very, very hard to diagnose. You're not going to see it on an image. You're not going to see it on an X-ray. You're not going to see it on an MRI. You're going to see it by getting somebody that knows what it is, right? By feeling. There's some bony landmarks that you can feel on people, and you can do a diagnostic testing that way. But as far as imaging, it's not going to be seen. So very difficult to diagnose. Oftentimes overlooked. Signs and symptoms would be, it hurts when I sit, hurts when I lay down, bend over, I have pelvic joint pain, pain radiates into my groin, or wraps around my thigh from the back into my groin. It's very common in all ages, especially during and after pregnancy. My wife just went through this. The ligaments get all loosey-goosey. And so what is the SI joint? If you look at the image here, you can see that where the sacrum is, it meets what's called the ilium, or the pelvis. And it's a joint that doesn't have a lot of motion, but there's a little bit. And so, but basically it's an intersection. It's where the spine connects itself to the pelvis. So if you have something around that, either below or above, that's not functioning correctly, you're going to get compression or friction at that joint, and that joint's going to rub and it's going to inflame. And then the inflammation then pressurizes the area, and the nerves are going to get irritated. Okay? But less likely to have that sciatic pain, but more in the groin. And they're really red flag areas that hurts when I sit. Can you heal this? Absolutely. It's really just inflammation. So you have to reduce the inflammation through movement that doesn't cause friction. And most commonly, too, when you meet somebody, what happens in that area is there's actually, since there's movement there, what you'll see is there'll be an alignment problem. So one part of the pelvis will be not level compared to the other, and there'll be like a whopper-jawed pelvis, is kind of how I describe it. And so the first step is to realign the SI joint through what we would call manual therapy, mobilization, manipulation sometimes, which would be chiropractic or physical therapy too, but first resetting it and then trying to figure out what caused that area to go out of alignment in the first place, which we'll talk about in a minute. The two areas that are most common are the hips and the upper back. If those things aren't moving in sync, then you're going to have a problem where that's going to get twisted and it's going to get stuck. And not a fun feeling. We're going to skip that one. Anybody have any questions on the SI joint? I went pretty quickly on that one.
No, but I do have a question.
Yeah.
A lot of people have one leg longer than the other,
Yes.
or whatever, and I do too. I mean, a little bit.
Yep.
Could that cause these problems as well? And what can I do to? Okay.
So that's a really, absolutely. So when you have, first of all, there's two types of leg length problems. One is you're born with it, so we'll call that structural. That's only 10% of the population.
I was born with it.
Okay, 90% of the people have what's called a functional leg length, which is actually when your SI joint gets out of alignment. Then since the pelvis gets out of alignment, it pulls one leg up because the femur attaches to the pelvis. But yes, that is the number one cause actually, that what would cause the alignment happening in the first place. So again, fixing the alignment is only fixing the symptom. Look into the leg length, or the feet, or the hips, or the upper spine, and look at the dysfunction that might be causing it. Yes?
Since you hit on that, I've been told that I have arthritis in my hip, and that's what's caused my leg to be shorter. It's bone on bone right now. And it's also causing the irritation in my sciatic nerve with surgery recommended, hip replacement. Does that make sense to you?
It does. I would say that the arthritis would have to be pretty bad in the hip to make a leg shorter, but it's possible. But the idea that a hip is causing sciatic pain or low back pain is absolutely right on. I mean, there's no doubt about it. That's the most common thing you see is the hips being the issue.
I was a mailman for quite a few years, like
Yeah.
almost 15. Carried my bag on this side.
Sure.
This is the side that has the problem.
Yeah, I would be really interested in discovering whether or not the leg length is truly structural. It doesn't happen very much. I don't see people that come in that have arthritis that causes leg length problems, but I do see leg length problems a lot. And I see 90% of them being because of alignment issues and because muscles and hips don't move right. So that would be my thought, if that helps. Yeah.
How often do you have to be aligned? Okay, so you come in and you get realigned.
Ideally, never. I mean, ideally, if we're doing a good job and you identify the dysfunction, then if we align you one time and with prescriptive movements to correct the muscle imbalance, whether it's flexibility, strength, and stability, you shouldn't have to have it anymore. That's the thing that chiropractors miss, is that you need to get aligned all the time. Well, no, because every bone in the body has muscles that attach to it, except for one. Anybody know what it is? It's the talus in the foot, which is kind of cool. I wanted to name my baby that, but I'm not saying that.
Oh, my Lord.
So really, the answer would be that it's not normal to go out of alignment, and you shouldn't have to get adjusted multiple times, but what that does tell you is that something is not right in your body that's causing the alignment problem. Our bodies are not designed to, or I should back up and say, two outliers there. One is pregnancy, and two would be a fall. If I fall on my hip, really common to have that thing jar my SI joint and go to alignment. In pregnancy, because things are so loose in there that the ligaments the hormone relaxin gets released, and it's just everything's released. So it's very common in pregnancy. And then it's very common when things get tight again after the ligaments tighten back up that they didn't line up correctly because of whatever. Yep.
I have a general question about physical therapy.
Yeah.
So when you see your doctor and your doctor recommends that you do physical therapy for a specific thing, you're saying that the pain from that isn't necessarily the problem right there. It can be from your hips or something else. But insurance has said you've gone for this problem, so now we need to treat your hip, not your back, or whatever it is. Is that something that you as the physical therapist has to deal with, or does your doctor have to read?
No, so the way that the law is, we have to follow the law, right? Part of this is, there's a scope of practice to follow, and what that says is that if I have somebody for lower back pain, I can do anything with them. I can work on your neck, your elbow, your wrist, your foot, as long as I understand and can justify and explain how that relates to your lower back, right? But if I don't know, and I do something, wiggling your toe around, that's against the law. And that's when I'd have to go, if I was in front of a judge, and I'd say, well, I don't know why I wiggled your toe. Then you're malpractice, it's not good. So if you ever have had that happen, which I did have, when I had to go to this, what they're really saying is, I don't know how your hips would affect your lower back, so I'm not going to touch it. Even though it hurts, I don't know how it affects it, so I'm going to stay away from that. That's them basically saying, I don't know. Yep.
Earlier, you asked if any of us had 20 years ago PT.
Yeah.
And it was, 30, 35 years ago, in my early 50s.
Yeah.
I had my first bout of sciatica.
Sure.
And when I went in, I was also getting ready for a long car trip, and sitting killed me.
Yeah.
But they introduced me to the classic McKenzie exercise,
Sure.
the extension.
Repeated extension,
Yeah.
Yep.
And it worked like gangbusters.
Sure.
And over the years, I would control any sciatica with that.
Yep.
And then the most recent bout that I had, I came to you folks, and they told me to, stay away from that.
Yeah.
That it's the wrong thing. But which of these three things does that McKenzie exercise work so well for?
So that's a really good question. So what you got for repeated extension is really good for your age 35 years ago, right? Because your spine changes. So when your disc is crab meat and pliable, those repeated extensions are very effective. When your spine turns into you start to lose disc space and you start to get stenosis and arthritis, that actually becomes the exact opposite thing you want to do. How many people in their 80s with back pain do you see like this versus like this?
Yeah.
Right? And we'll talk about that. This is going to make a lot of sense in a minute. We're going to get right to that.
Okay.
That's the first time I see you do that. You've always used your shoulders and your arms or your legs, the bottom part of your legs. Your body never changed.
Yeah.
Can you bend over?
Can I bend over?
Well, without pain.
Yeah, oh yeah, sure.
Okay.
Yeah, I can golf without pain.
Well, yeah, you do that, yeah,
Yeah.
but not, your legs, but you wear out shoes?
I do. I do. All right. Stenosis. Most of the people in this room are going to relate to this. The reason I say that is over the age of 50. Here's the clinical predictor, which is a tool that we use that is based on research that allows us to put people in categories. If you're over the age of 50, you have lower back pain or sciatica with standing and walking, and it goes away with sitting down, there's a 97% chance you have stenosis. Right, so that's the MRI is already 97% accurate, right? So you've got an accurate tool that's been studied and it's been researched. And so how many people have pain in their back with standing and walking and goes away with sitting down? Anybody in the room or have had that? Okay, so the majority of people here that we're talking about have had something like this. You can see it with the grocery cart, you know, like I hear this a lot when I'm walking in the store. I have to lean on the grocery cart. And what it's doing is basically making me bend forward. We're going to talk about why that helps. You know, but you also hear the emotional aspect of it, which is, you know, I can't stand up and I can't walk and I can't play with my grandkids. I can't go for walks anymore. I can't enjoy life, you know. So it becomes one of those things that really affects, you know, walking and standing is like the most important thing we do. Mobility is life, you know. So it really starts to get emotional in that regard. Versus when I relax, it hurts, right?
Mm-hmm.
At least I can still function in my day.
Yeah, I could work all day.
Exactly, so I can still hang out with my friends, I just can't lay down on the couch because it hurts.
Yep.
What if you have both?
Yeah, what if you have both is a great question.
Can't
Can you
sleep.
have all three of these? Yes. Absolutely. It's funny, so one of the things I didn't tell you about my back surgery story was that 2 months before my back surgery, I actually broke my left ankle, which was my good leg. And I was in a walking boot. So the walking boot makes your legs different lengths, which then makes your SI joint go out of alignment. So I had all that going on at the same time. In fact, I can remember waking up from spine surgery and I kicked my boot off and I saw the neurosurgeon walking by and I was like, or the ortho surgeon, and I was like, I'm taking this thing off. I was all going. Anyways. So, yep.
Does stenosis make both legs hurt?
It can. We'll talk about that. So on both sides of your spine, you have nerves that come out of the spine in a hole. Next slide, we'll get to that in a second. And there's also two types of stenosis. So the one we're talking about right now is, and let's just say stenosis is the Greek word for narrowing. I believe it's Greek. Latin? What's most medical terminology would be Latin, right? So it's a Latin word for narrowing. And what that means is where the nerves come out of the spine, there's a hole, and that hole is bony and it narrows. The second type is where the spinal cord sits in the spine. That's called central cord stenosis. That's a much bigger deal, where that hole gets narrow and actually closes down the spinal cord itself. And so you can have, for instance, that would be both legs, and sometimes even both legs and arms, and it becomes a bigger deal.
I'm her husband.
Yeah.
Part of the reason we're here is exactly what you're covering, information.
Yeah.
She's had, well, 0 cartilage on the top surgery of the hip sockets and back pain. And we've seen specialists for each. And the thing that is so frustrating, we've been to many specialists and contemplating something but don't know what.
Yeah.
They expect her to know and to decide.
Right.
That drives my head to the point.
Right. They almost look at it as an elective surgery, which is kind of crazy.
Yeah. When you know, when you're ready, you'll know.
There's a reason. There's a reason for that. The reason for that is if they can terminate an elective surgery, you've chosen to do it, then the liability is a lot less. Like if they mess you up.
I thought it was just because one office does one does the other, and it's revenue.
So it becomes like, well, you decided to do this. So there's a reason. I got an image here, so this is cool. This is actually showing, I'm going to use the mouse cursor. Can you guys see that? Here's the disc, and what happens as we age, we talked about the disc space becoming, or the disc itself becoming more like leather. It also gets less fluid in it, so it shrinks down, it becomes narrow. And so what happens when this gets narrow, these are two individual bones that sit on top of each other. When this gets narrow, the nerve that comes out of the spine, that hole gets narrow as well. So the natural aging process of a disc getting less liquid makes the hole for the nerve to come out more narrow. But it's really, really important to identify or to understand that the hole that we're seeing right here is 1/2 circle from the segment on the top and 1/2 circle from the segment on the bottom. It's not a complete circle. And the point of that is that hole is dynamic. So I can make movement happen where that hole gets small, and I can make movement where that hole gets big. Okay? And so I'm going to hit this real quick. There's 3 ways to make the hole small. three motions that we can do, and we're gonna reference the right side right now on my back. If I extend my back backwards, that makes the hole smaller, okay? If I lean to the right, that makes the hole smaller. And if I rotate away, so if it's my right side, if I turn to the left, that makes the hole smaller. So what's the golf swing follow through? If it's my right side, I've rotated to the left, makes it smaller. I've leaned to the right, because it's my follow through, makes it smaller, and I'm also extending back because I'm looking down there. So that's why golf becomes one of the most stressful things you can do for the spine. That's why so many golfers have pain. Now, we can flip that and say, okay, there's three motions to make the hole bigger. They're the exact opposite. I can bend forward, it makes the hole bigger. I can lean away from it, or I can rotate towards it. Those are three ways to make it bigger. So if I'm in the golf swing, the follow through is gonna, or the backswing is gonna make it bigger. So that's why you get so many golfers with one side of their back is hurting and one is not. So, what do we do? I'm gonna go to my next slide here. So we talked about the three ways. The hole is dynamic, so that's why when you have pain like this, it changes with certain movements and it gets better and worse with some movements. So that's where we come in and say, okay, if we want to treat the symptoms, all we have to do is make the hole bigger. So that's what traditional physical therapy does. It makes the hole bigger. So they give you things like sit in a chair and reach to the ground, lay on your back, pull your knees to your chest, child's pose in yoga. Those are all things that are going to be symptom treatments, right? So make you feel good temporarily. But the real trick is, how do we figure out in the body what is happening to make the hole get smaller when we move? And that's where it's not as easy for me to tell you that list, because every person has a different thing that makes them feel worse. So you have to look at the movement, you have to identify what's happening during the movement, and figure out which one of those three motions is happening that would close the hole down, and then how do we steal motion from somewhere else in the body to make that hole not close down as much. Does that make sense?
That was true.
Thank you. So, can you heal it? Yes, you make the hole bigger. Again, research indicates 85% of the time people are successful. The surgery is a little different for stenosis. The only option there is fusion. Okay? What they do is they fuse, they take that disc that was narrowing and they open it up, they do decompression, and then they fuse it that way with the plate and screws. The problem is, you've taken away motion now completely at that segment. And the spine, as a one whole unit, relies on every one of those segments to move equally when we're doing things. And so now you've asked the area directly above and directly below to move more. And so what happens 2 years later, 3 years later, is that those segments get worn down because they're moving too much. The nerve gets irritated, and the surgeon does another spinal fusion. And they keep going. And there's a limit to how much they can do.
So back in that picture, Andrew, you showed both